Geroprotector secrets you must know. What if aging wasn't something we had to accept? What if we could slow it down or even reverse it? Welcome to the future of medicine, geroprotective therapies. In this section, we will explore how cutting-edge science is redefining what it means to grow older. Here's something surprising. Aging is the #1 risk factor for heart disease, cancer, Alzheimer's, and diabetes. If we can slow down aging itself, we could delay or even prevent all of these diseases. Geroprotective therapies don't aim to treat just one illness. Instead, they target the root biological causes of aging, offering the potential to delay or prevent multiple diseases at once. There are 12 hallmarks of aging, key biological changes that drive the aging process. Most geroprotective therapies are designed to target one or more of these hallmarks. Imagine cells that refuse to die, yet no longer function. They just sit there, leaking harmful substances that damage neighboring tissues. These are senescent cells, often called the zombie cells. They build up as we age and contribute to inflammation, tissue breakdown, and diseases like arthritis, fibrosis, and even cancer. Senolytics are a class of therapies designed to identify and remove these dysfunctional cells. By clearing them out, we allow the body to regenerate, heal, and function more youthfully. Senescent cells aren't just sitting idly. They are actively releasing a mix of toxic molecules called the senescence-associated secretory phenotype, or SAS. This cocktail of inflammatory cytokines, enzymes, and growth factors accelerate tissue aging and promotes chronic diseases. The presence of even a small number of these cells can lead to a cascade of inflammation throughout the body. The good news, we now have a strategy to selectively remove them. Early studies combining dasatinib, a cancer drug, with quercetin, a plant flavonoid, showed powerful senolytic effects in mice and even in small human studies. In one landmark trial, this combo reduced senescent cells burden and improved physical function in older adults with pulmonary fibrosis. Another promising compound is fisetin, found in strawberries and apples. It's been shown in mice to extend lifespan and reduce age-related decline, and now human trials are underway. These aren't just lab theories. Senolytic clinical trials are already in motion. The Mayo Clinic has tested senolytics in patients with lung fibrosis. Wake Forest University is exploring their use for frailty and muscle loss in older adults. And biotech companies like Unity Biotechnology are developing drugs to tackle neurodegeneration and eye diseases by targeting senescent cells. While senolytics hold great promise, we're still learning how best to use them. Current research suggests intermittent dosing, often referred to as hit-and-run therapy, may be effective, giving the body a chance to clear the senescent cells without long-term drug exposure. But we must proceed with care. Senescent cells also serve important roles in wound healing and tumor suppression. The goal is precision, not a cellular purge. That's why clinical oversight and more trials are critical. Senolytics are an exciting frontier in longevity science. By targeting and clearing harmful senescent cells, they promise to reduce inflammation, rejuvenate tissues, and extend healthy years of life. They're still early in development, but the science is gaining momentum. One of the silent drivers of aging is the slow, steady decline in blood flow to your brain, to your muscles, even your organs. Poor circulation means fewer nutrients, less oxygen, and slower cellular repair. That's where VEGF, or vascular endothelial growth factor, comes in. VEGF is like nature's architect. It stimulates the growth of new blood vessels from existing ones, a process called angiogenesis. By boosting VEGF, we may be able to reverse age-related vascular decline, improving brain function, energy, and tissue regeneration. So VEGF is released by cells when oxygen is scarce, like during exercise or injury. It binds to specialized receptors on blood vessel lining, triggering those cells to multiply, migrate, and build new capillaries. This process enhances tissue oxygenation, remove waste more efficiently, and promote cellular rejuvenation. It is a critical mechanism not just for healing, but for slowing vascular aging, a key driver of cognitive decline, fatigue, and frailty. Your brain is extremely sensitive to blood flow. With age, brain perfusion drops, especially in the memory and decision-making centers. Low VEGF levels have been linked to cognitive decline and even Alzheimer's. Animal studies show that boosting VEGF can stimulate the growth of new neurons and improve learning and memory. This has major implications for neurodegenerative diseases, and human trials are just beginning. VEGF doesn't just help the brain, it also plays a vital role in muscle performance. As we age, reduced blood flow leads to muscle atrophy, reduced oxygen delivery, and impaired recovery. VEGF helps maintain capillary density in muscles and enhances the delivery of nutrients and oxygen. This means better stamina, faster healing, and even slower loss of strength, especially important for fighting frailty in aging adults. You don't necessarily need a drug to increase VEGF. Certain activities and compounds can naturally stimulate its production. For example, exercise, especially high-intensity interval, triggers VEGF by increasing oxygen demand. Hypoxic training, NAD+ booster, intermittent fasting, and even low-dose rapamycin may also enhance VEGF signaling. These tools may one day form the foundation of a new kind of vascular rejuvenation protocol. While boosting VEGF has clear benefits, too much can be risky. High VEGF levels can support tumor growth by feeding cancer cells with new blood vessels. That's why future therapies will likely focus on precision activation. Targeting VEGF increases only where they are needed, like the brain, the muscles, or damaged tissues. VEGF may be one of the most promising but least talked about geroprotective tools. From rejuvenating the brain to recharging your muscle, VEGF-based strategies offer a way to restore vitality by rewiring your blood flow. The future of vascular longevity is just beginning. Now let's talk about metformin, which may be the most widely prescribed anti-aging drug you have never thought about. While it's traditionally used for type 2 diabetes, researchers are now looking at metformin through a very different lens as a tool to slow biological aging. It activates AMPK, the master regulator of cellular energy, mimics caloric restrictions, and reduces chronic inflammation and oxidative damage. 3 major pillars in the biology of aging. At the cellular level, metformin acts like a metabolic optimizer. By activating AMPK, it shifts the body from energy storage to energy utilization and cleanup. This encourages autophagy, your body's internal recycling system. It also turns down the inflammatory fire by suppressing NF-kappa B, and it reduces reactive oxygen species, or ROS, which damage DNA and proteins over time. These actions make it a powerful candidate in the quest for healthy aging. Now, think of AMPK as your cell's fuel gauge. When energy runs low, like during fasting or exercise, AMPK kicks in to conserve resources, boosts fat burning, and clean up cellular waste. Metformin keeps AMPK on alert, helping the body mimic the benefits of intermittent fasting and caloric restrictions, both proven to extend lifespan in lab models. It's like a biohack in a pill. The TAME trial, T-A-M-E trial, or the Targeting Aging with Metformin, is one of the most groundbreaking clinical trials in the longevity field, led by Dr. Nir Barzilai. It's testing whether metformin can delay or prevent multiple age-related diseases in healthy, non-diabetic adults. Over 3,000 participants aged 65 to 79 are being monitored for cancer, heart diseases, cognitive decline, and changes in biological aging marker. This is the first time a drug is being tested not to treat one disease, but to target the aging process itself. Multiple studies have shown surprising results. In the UK Biobank study, people with diabetes taking metformin actually lived longer than those without diabetes, not what you would expect. Animal studies confirm its ability to extend lifespan, improve metabolic health, and reduce inflammation. In lab-grown human cells, metformin lowers DNA damage, oxidative stress, and signs of cellular aging. As exciting as metformin is, it is not a miracle pill. Some people experience gastrointestinal issues or vitamin B12 deficiency. And in certain older adults, metformin may actually blunt the benefit of strength training by interfering with muscle growth. Like most longevity tools, metformin works best when paired with personalized strategies and medical supervision. So who might actually benefit from metformin? Possibly those with early metabolic dysfunction, family history of chronic disease, or high level of inflammation. It's not just about treating disease. It's about intervening earlier when the body still has time to respond and regenerate. Metformin may be one of the most important longevity experiments of our time. It targets multiple aging pathways, mimic fasting, and is already safe, cheap, and widely available. While we wait the results of the TAME trial, it offers a powerful example of how old drugs are being reimagined to slow down the aging clock. In lab animals, NMN has shown some remarkable benefits. So let's talk about NMN now. Older mice on NMN ran farther and had better muscle function. In a 2022 human study, NMN improved muscle insulin sensitivity, which is vital for energy and weight control. And in cells, NMN activates sirtuins, which are proteins that help repair DNA and protect against stress. While human trials are still early, the data looks promising, especially when combined with other longevity tools. NAD+ isn't just about energy. It also turns on a set of genes called sirtuins, sometimes referred to as your longevity guardians. These genes manage stress, clean up damaged protein, and improve metabolism. NAD Plus also supports DNA repair. Enzymes like PARPS and plays a role in building new mitochondria, your body's energy engine. Low NAD Plus is linked to fatigue, brain fog, and even age-related diseases. Now, NMN isn't a silver bullet. There's ongoing debate about how well it's absorbed orally, although newer formulations like sublingual NMN or liposomal NAD plus precursors show promise. It also is expensive and not yet approved as a treatment by the FDA. And just like anything in biology, more isn't always better. Balance is key. Beyond metformin and NMN, there's an entire toolkit of emerging geroprotectors. Rapamycin, which inhibits mTOR, has extended lifespan in nearly every species studied. Melatonin isn't just for sleep, it supports mitochondria and helps regulate the circadian clock, a key aging mechanism. Glycine helps with metabolic balance. Carnosine protects against glycation, a sticky process that damages protein. And DSIP, or delta sleep-inducing peptide, is being explored for improving deep restorative sleep and reducing stress load. The geroscience hypothesis asks a radical question. What if we stop chasing individual diseases and instead treat the root cause, aging itself? Instead of separate drugs for heart disease, Alzheimer's, and arthritis, we could target aging biology directly, potentially delaying all of these conditions simultaneously. This approach could revolutionize medicine, shifting from disease management to true Healthspan optimization. We're entering a new era of medicine where aging is no longer something we just accept, but something we understand and intervene in. From clearing zombie cells to recharging your mitochondria, these geroprotective strategies offer a holistic way to stay healthier and longer. The future of longevity isn't science fiction, it's unfolding right now. So what's next in the world of geroprotection? First up is the TAME trial, or Targeting Aging with Metformin, a groundbreaking clinical study testing whether common diabetes drug can slow the onset of multiple age-related diseases. This is one of the first trials to treat aging itself as the target. Then there's the wave of next generation NAD boosters beyond NMN. Think NRH, a dihydronicotinamide riboside, and combination precursors designed to restore cellular energy more efficiently. The senolytic drug pipeline is also heating up, with pharmaceutical companies developing targeted molecules that can selectively kill senescent cells without harming healthy tissues. And perhaps most exciting, personalized geroprotection, as testing for things like epigenetic age, NAD plus levels, and inflammation biomarkers improves. We're moving toward a future where your anti-aging protocols is as unique as your fingerprints. Let's zoom out and look at the landscape of leading geroprotective therapies. Senolytics offer a targeted way to remove aging cells, showing strong promise in animals and early results in humans. Metformin has a long safety record, and evidence from observational studies suggests it reduces cancer, cognitive decline, and cardiovascular risks, all without weight gain or hypoglycemia. The TAME trial is aiming to confirm these benefits in a large aging population. NMN, the NAD precursor, is widely used over the counter, and early human trials show it may improve energy metabolism and vascular health. VEGF, still experimental, could help rebuild blood flow in the aging tissues, particularly the brain and muscles. And rapamycin, the mTOR inhibitor, has consistently extended lifespan in lab animals and is being quietly used as a growing number of biohackers and longevity physicians. Look ahead. The future of longevity medicine lies in combining these therapies in a smart, safe, and evidence-driven stack. Imagine taking a low-dose senolytics every few months while maintaining daily NAD support, metabolic regulation with metformin or AMPK activators, and circadian balance with melatonin or DSIP, all personalized to your biomarkers and genetic risks. This is the cutting edge of preventative medicine, not just treating disease, but building resilient biology. The question isn't, can we slow aging? It's, how far can we push it back? We're entering an era where aging is no longer something we just endure. With science on our side, we may be able to master it. The future of healthy aging is here. Are you ready to unlock it? If this inspired you, there's more. Join our community at Thrivespan Elite to stay on top of cutting-edge health strategies that keep your brain sharp, your body strong, and your years full of life.
Please don't forget to like, comment, share, and subscribe.